Steenhuisen, NHI being a dream the ANC can't fund?
Well, I don't think it's a dream. I think it's a nightmare. And if you look at what NHI is, it's going to be Eskom for the healthcare industry, because that's essentially what you're going to do.
So free healthcare, affordable healthcare, equality of access to healthcare in South Africa sounds cool, right? But the DA boss, John Steenhuisen, in this video exposes something that probably might have been missed in the analysis of that bill, and especially what's driving the whole criticism against the NHI bill, the National Health Insurance Bill that is going to be signed by President Ramaphosa. Let's listen to this speech by John Steenhuisen, and I'll be back to make some analysis.
Steenhuisen, NHI being a dream the ANC can't fund?
Well, I don't think it's a dream. I think it's a nightmare. And if you look at what NHI is, it's going to be Eskom for the healthcare industry, because that's essentially what you're going to do. And we all see how well Eskom's is operating. I believe fundamentally that every South African needs to have their constitutional right to access to healthcare realized. But it's not going to happen through the NHI. And again, it's a case of the ANC trying to run before they can walk. The reality is, having traveled around South Africa and sat with cancer patients whose only lifeline is a state hospital, who have had their oncology treatments delayed time and time again because the oncology machines are broken, there's a shortage of the doctors that are required, they don't have access to the medication that is required. These are the basic things. Things like basic health care, making sure that people's primary health care needs are met, are not even being achieved. Now you're going to try and layer a very complicated and expensive system over a failing basic system. It is a recipe for disaster, which is why we've put forward a credible costed plan for ensuring that every South African will have access to universal health care. And it focuses on introducing a social reinsurance scheme. It focuses on being able to introduce a risk equalization strategy to be able to fund and improve the public health care system. We're not going to solve the problem by giving the ANC now another blank check to manipulate the healthcare system in the way in which they've manipulated our energy system, the way they've manipulated every state and entity they've been given authority over.
Thank you, Mr. Steenhuisen.
Yeah, so what do you guys think? I think I'm going to analyze this from a recent video I just found on Salam Media that sort of like was an interview with the South African Medical Association chairperson, Dr. Mvuyizi Mzukwa. And I think there's some really interesting points he raised, especially as the chairperson of this association. And they've been the ones, you know, raising the torch of critique against this NHI bill, which President Ramaphosa is meant to sign today. So Dr. Mvuyizi, when asked what the NHI bill is, he actually says that the NHI bill is like a universal health coverage that entails a pooling of funds, like a large medical aid that will be rolled out by the government to all South Africans, whether employed or unemployed South Africans, and that this bill sort of like drives to purchase services, I think health services in this instance, both from the state and the private sector. Okay, and so Dr. Mvuyizi, in his response to why there are heavy criticisms, especially from health professionals, you know, for such a bill that's supposed to bridge the gap between, you know, bridge the gap in access to healthcare in South Africa. In other words, to sort of like achieve equality and reduce inequality in access to healthcare. Dr. Mvuyizi says that, you know, the South African Medical Association supports the tenets of the idea of the NHI bill, the National Health Insurance bill, but his problem is that the infrastructure in South Africa is not yet ready for equitable access to affordable health care, because he says that the system is not ready, especially considering the fact that the rural areas have no clinics, they have no hospitals, they have an acute shortage of doctors in those regions, and also the fact that, you know, the South African Medical Association argues that there's an issue, lots of issues with ethical leadership in this area, and also massive corruption at the level of the government's wider policy on health. He's also arguing that, you know, that most of these issues have been raised but by the South African Medical Association, but they've not adequately been responded to by the government, okay? And he's also worried. He also says that he's worried that the NHI bill only caters for the finance aspect of the policy, but other areas of the entire scheme, such as the infrastructure, the maintenance, the technology, the shortage of doctors and nurses, issues with leadership and government, issues of clean running water, which was promised 30 years ago, is still a problem. And so such a complex bill as the National Health Insurance Bill wouldn't be effective to pass such a bill when these structures around what the bill should succeed upon are largely lacking. And so he's criticizing the ANC that if the government cannot afford an issue such as simple clean running water, then how will it attend to such a complex issue as the National Health Insurance Scheme? And those are really valid arguments. Those are really valid arguments. When he was asked, when Dr. Mvuyizi is asked, what does the National Health Insurance Bill mean for those who are constantly paying the medical aids, monthly medical aid payments, which I think is a system in South Africa there, and then how this NHI bill would conflict with the medical aid rates. Dr. Mvuyizi says that even though the ANC signs the bill into law today, that the entire health system will still remain the way it has always been, as it is at the moment, actually, because the NHI policy, the National Health Insurance Scheme policy, in his own understanding, will take at least 15 years before it's effectively implemented, you see. And it will be too premature at the moment to end the medical aid rates, monthly medical aid payments, because of this fact. And that because this NHI bill is promised, even though President Ramaphosa signs it now, and he doesn't succeed in being the president after the elections coming soon, that the government promises that this is going to be a phased policy. In other words, it's going to be a policy that's going to be done in phases. So the first phase would cater for the primary healthcare level, and then the later phase will now focus on healthcare at the level of the hospital. So it will definitely take time to achieve such a bill. So finally, when asked if this is a publicity stunt in a way to drive voters to kind of like rake more votes during this time when the country is moving closer to elections, Dr. Mvuyizi argues that this is a strategy by the ANC to use this health insurance thing to try to see if it can secure more votes from the electorates in its support, because of the pressure right now on President Ramaphosa and the pressure on the ANC. So, but for me, I really think that there's a lot of criticism around this. I've seen almost 15 videos only from 2 days ago, actually, when this whole bill was announced that it would be passed today. And a lot of South Africans are really worried. I know the healthcare system is a really interesting issue in many countries. If I take in West Africa, for example, there's really there is a sort of like a national scheme that manages health insurance, but most people usually tend to patronize private health services because the private health services seems to have all, the necessary instruments, technology and all that can save lives at least. And most public health facilities have been deteriorating. And John Steenhuisen here in this video speaks about how this kind of policy would really continuously increase the capacity for corruption by the ANC government, because since all of the pool of the funds will be in control of one person, it would be easy to for other cronies associated to that manager of the pool of funds to kind of like have access in a way if this is not really well managed and structured at the level of the state. So it would give rise to more and more corruption, which I think South Africa has really been accused of really debilitating structures of corruption and integrity and all that. But I don't know how you guys read this, but these have been some of the challenges from the medical professionals. And Dr. Mvuyizi also speaks about how the ANC should also be cautious, because during the AIDS denialist period at the time, when lots of people lost their lives to the AIDS pandemic, one central reason was the fact that the ANC refused to listen to the professionals, and that he's afraid that this NHI bill is sort of like a repetition of that event, and that we really hope that we do not experience more losses of lives because of this bill. But I don't know, what do you guys think about these comments? And this is a really sensitive one, but share your thoughts in the comments.